Hi and welcome to this introductory video. My name is Dr Kynaston-Pearson and I'm a consultant rheumatologist. If you meet in clinic, that's how I'll introduce myself, but for simplicity some of my patients prefer to call me Dr KP. It's quite a difficult question to honestly answer as to exactly what made me become a doctor. I think most doctors would share a number of common motivations and drivers. An interest in science, a desire to work with people, a desire to put that knowledge of science into trying to help people. But why a doctor and why not a researcher or a nurse or other aspects? Quite difficult to answer. I tried different areas in healthcare. I worked as a healthcare assistant and a phlebotomist, but I really liked the idea of trying to uncover the diagnosis and, if you like, to be in the central position of leading on the management care. And the more I looked into it, the more I looked into the pathway of becoming a doctor, the more I felt this was right. And although I've had my wobbles along the way, as anyone does in a difficult profession, I'm very happy to continue to be practicing as a doctor in the NHS and in my private practice. Rheumatology is quite a unique medical specialty, and actually one that most doctors and medical students don't get a huge amount of experience in. I knew I quite liked the challenging diagnostics when people weren't quite sure what was going on. I enjoyed the holistic side of rheumatology because the conditions, they could affect almost all parts of the body, and I thought that was fascinating. I also thought they were interesting treatments, but beyond that, the actual practice of rheumatology really appealed to me. The idea that a patient could potentially come under your care as soon as they transferred into adult medicine at the age of 18 or 16 and could potentially be under your care all the way through your career really appealed. That idea of potential follow-up and the nature of the condition, meaning that you could look at treating all aspects of a patient's care rather than just focusing on very specific organ systems, certainly was a big appeal. To be honest, part of the reason I became a rheumatologist was the teachers who inspired me. When I was working as a trainee, I had some excellent mentors and they opened my eyes to what a career in rheumatology could be like, and that was the point when I really decided, yep, this is the job for me. I wouldn't say I have a particular mantra or catchphrase to how I practice, but I try to keep in mind what would I want to do if this was one of my family members or loved ones. I think as long as you keep that in the heart of your practice, you can't go too far wrong. I don't really want to answer a question on what patients most value about me. You probably have to ask my patients themselves. But I hope that when they see me, they get some benefit in that I do my best to try and teach my patients who come and see me a little bit about what's going on. And that will tailor according to someone's background. Of course, someone might not be particularly interested in the science of it. Some of my patients may be university professors and really want to get into that detailed area of the science. So I try to tailor my explanations to people's expectations of what they want to know about their condition so that they can walk out with a bit more knowledge. And I try to make my management plans on a shared basis. So although there are times when a treatment plan is really clear to me and it seems obvious what the best option is, quite often in rheumatology that's not the case. And there may be a series of options that have different pros and cons, and I like to give patients an opportunity to explore the ups and downs of each option and come to a shared decision with my patients so we can both go forward together as partners in the treatment process. Rheumatology is complicated. It's therefore quite challenging to do a very good job in a short space of time. It's a time-consuming area, particularly some of the more complicated multi-system conditions, and it hasn't completely been explored. So it's not always obvious that there is an absolute ideal option, and sometimes you're left with a choice of several possibilities, and sometimes you don't get exactly all the bits of the jigsaw that you need to completely confirm a diagnosis. So you're left with quite a lot of decisions being made upon your expertise and your clinical opinion, and the same goes with the treatment plans. Now that can be really rewarding because it means that you are able to put your own stamp on how you practice, but it can be quite challenging and disconcerting because you're not necessarily following very large scale randomized controlled trials in every case, because some of the things that we treat in rheumatology are uncommon, and sometimes the conditions that our patients come in with mean that they don't necessarily follow the standard treatment pathway. So that can be a challenge at times for sure. I think the most rewarding thing I found is some of the same reasons that I chose to go into the specialty. I like the fact that you can treat someone from age 16 all the way up to well, however old they can get, really. And I quite like the fact that you've got a mixture of men and women. So it's not sub-selecting out any one particular group of population. I really enjoy the variety of people that I meet in clinic who come from all walks of life, all different professions. So I like that that personal encounter, and I think a lot of rheumatology is based upon the the relationships that you can build up with your patients. I do find the science of it fascinating, and I think the developments in what we've been able to achieve in the last few decades in rheumatology, the excellent treatments in biologics and targeted therapies, has made it a very rewarding area to work in, because by and large we can help most patients that come through the door with quite selective medications. And even in the treatments where we're still undergoing a lot of research, we are usually able to support our patients with some form of therapies and other supportive interventions so they can live well with the conditions in this field of rheumatology. And all of those factors make it a very rewarding area to work in.